This video will demonstrate the expected practice for point-of-use treatment in sterile processing instruments following a procedure. Biofilm formation can begin within minutes after a device has been used. By performing point-of-use treatment and cleaning the gross debris from device surfaces, the population of microorganisms is reduced and biofilm formation can be prevented. Depending on the area where you are working, you may see a different sized biohazard bin, small or large. These bins will be obtained from the clean utility room on the unit where you are working. Supplies will be located within and near the bins in the clean utility rooms. Located within the bin, you will find supplies and personal protective equipment. You must also obtain the appropriate pre-treatment spray. Take the biohazard bin and pre-treatment spray into the procedural area, such as the patient's room, following the procedure. Appropriate PPE must be worn during the instrument decontamination process. Don the included gown, mask with face shield, and gloves. Before cleaning the contaminated instruments, make sure to remove all sharps, such as needles, blades, and trocars, as well as the disposable items and trash. Open the included pack of gauze. Note that more may be needed if cleaning several instruments. Moisten the gauze with water only. Saline must never be used to clean instruments, as it can cause the instruments to corrode. Using the moistened gauze, clean the gross debris and bodily fluids from the instruments in the procedural area. Bodily fluids that become dried on instruments make the devices much more difficult to clean. Prompt cleaning and removal improves the efficiency and effectiveness of decontamination. Be sure to thoroughly clean each instrument. Make sure to open any hinged items and clean them well. Note that this video will demonstrate the use of both the small and large biohazard bins. Open the appropriate biohazard bin. Use the included stringer to restring the handled instruments. This will allow the instruments to be thoroughly pre-treated. In the procedural area, spray the instruments with the pre-treatment spray. This will keep the instruments moist and will aid in prevention of biofilm formation. Now we will demonstrate the process with a large biohazard bin. Repeat the same process by using the included stringer to restring the handled instruments. Thoroughly spray each item with the pre-treatment spray. Ensure that all instruments have been cleaned and are sent together in the biohazard bin. Firmly close and latch the biohazard bin. Remove the clean sticker to reveal the dirty contamination sticker. This bin will then go to the soiled utility room. Wearing new gloves, clean the pre-treatment spray bottle with an appropriate cleaner before returning it to the clean utility room. This bottle will be reused for another procedure. The contaminated instruments contained within the biohazard bin will need to be transported to the soiled utility room. From there, call Aramark to retrieve this bin and return it to sterile processing.